working on a deck in Wildwood, and it was the last post, a 6x6 rough cut cedar, and you have to hold the guard up on the saw to get it going. I had my hand like this and was looking at the back of the cut and rolled the saw forward and off it went.
So Billy had a real severe injury to his thumb. He was working on a deck when he had a saw actually amputate the thumb or completely separate it from his hand at the time of the injury. Luckily, he was taken quickly to an outside hospital where they brought him and the part of the thumb in with him, and then we arranged for a transfer over to us to treat him. So once Billy made it to our hospital, we evaluated him in the emergency department to better assess his degree of injury, and then we quickly got him up to the operating room to try to get things fixed if it was possible to repair his thumb and actually get it put back on or replanted. So once in the operating room, we started addressing each of the important structures in an orderly fashion to get everything repaired. First, we fused the joint that was involved with the saw injury to get the bone to be solid, and we fixed that. And then we actually repaired each of the tendons, both the one that bends the thumb down and the one that brings it back up. And then we turned our attention to the smaller structures. And for that, we brought in the microscope, and working under the microscope, we were able to repair each of the nerves in his thumb, which there's one on each side, as well as the arteries to bring the blood into the thumb, and then several veins to bring the blood back out of the thumb. And fortunately, in Billy's case, everything went very well.
Dr. Calfee was my surgeon. He was the best doctor I've ever had by far. He was he gave me a confidence that, with an injury like that, you think especially somebody like me who works with my hands every day, all day. I thought I was going to have to get a desk job somewhere, and he reassured me that it was fixable, I guess you could say. It was the most confidence I've ever had in a doctor, or in another person for that matter. And the way he treated everything from the get-go was, I don't want to say like I was his son, but like he had more, like he was more involved than just my doctor. He wanted me to be able to work again, and I can't thank him enough for that. Without him, I don't know what I'd be doing today. I'm going to school for a welder right now and getting all my certifications, and I don't think I could do it if it wasn't for Dr. Calfee at all.
So post-operatively, Billy did excellent. He got back to working on his cars. He had some slight limitations due to the scar tissue from the injury, and so subsequently we did do one additional surgery to release some scar tissue in the web space between the thumb and the other fingers, and also get some of the scar tissue off the tendon on the back of the thumb to allow him to extend the thumb fully. He recovered very nicely from that surgery and actually got back surprisingly without any obvious limitation in motion, and had very good sensibility or feeling in the thumb.
I think the recovery as a whole, from day one to now, it's kind of incredible. To think that part of my body was detached and laying in somebody's driveway at one point in time, and now it's totally usable, and it's perfect. It's like nothing even happened. I can't thank Dr. Calfee enough. If you ask me, he's the best doctor in the world, but the guy's great. Everything from the get-go was great, and Sue Ellen, his assistant, she's also awesome. I can't thank her enough. Everybody just. I have so many people to thank, and it's almost kind of bringing me to tears now thinking about it. But it's so much went into it, and I didn't have a choice about it all. I didn't choose my doctor. I didn't choose the nurses. I didn't choose any of it. It just happened, and it worked out perfect. It's just I can tell you this much: if I ever got hurt like that again, I know exactly where I'm coming.
So fortunately for us here at Washington University, we've got the right surgical teams and resources to care for injuries like Billy's. And we've got a good experience caring for this type of injuries and have many other patient stories just like Billy's.